Hello, this is Dr. Safe. In this video, I will explain what is narrow angle and what is angle closure glaucoma, what we can do to prevent it. This is a diagram of a normal eye. As you can see, fluid in the eye is produced by a muscle called the ciliary body, as highlighted in that label called aqueous produced. The fluid from there migrates behind the iris, as shown, and comes to the front of the eye through the pupil. From there, it can then drain out of the eye through an area called the trabecular meshwork, which is at the angle between the cornea and the iris, as shown by the star. As long as the fluid going in the eye is the same as the fluid exiting the eye, then you have a stable eye pressure, which is the case most of the time. Now, if the angle of the eye formed by the iris and the cornea is more shallow, this scenario can happen, which is called angle closure. The iris is touching the lens too much in this scenario, which is causing the fluid behind the iris to have trouble to reach in front of it through a mechanism called pupil block. When this happens, the iris bows forward as shown, and that tends to block the angle. What we can do to prevent this issue from occurring, or to reverse the issue if it's happening, is called a peripheral iridotomy. In this, the laser produces a hole out in the periphery of the iris, as shown, and this allows for the fluid to go in front of the iris without having to go through the pupil. So in cases of pupil block, we have another alternative route. This ensures that the iris stays flat as the pressure in front and behind it remain relatively equal, and that allows the angle to remain open. When I see patients who are sent to me with narrow angles, I look at the space between their iris and their cornea through a slit lamp, and this is what I see. This is a grating which shows the amount of degrees in which the iris is open. Whenever I see a patient with an opening of 10 degrees or less, I usually recommend the laser procedure. The procedure is important, obviously, to prevent angle closure glaucoma, which can happen all of a sudden. In that scenario, patients develop severe pain, nausea, and vomiting, as well as decreased vision. That vision loss can become more permanent if the pressure isn't relieved in a timely fashion. The pressure builds up and starts to damage the optic nerve, the cable that connects the eye to the brain, and that leads to vision loss. That's the end of this short video. If you have any further questions, please do not hesitate to ask me when you see me in the office. Thank you.